We received the following question from one of our viewers. I am currently a manufacturing cybersecurity manager, retaking prereq courses and applying to nursing school as a second career. I saw your story post that you were also in computer systems as your first career, and I wanted to ask if you noticed any similarities that surprised you between the two fields, and were there any stark differences that you had to unlearn from your technical experience? Thank you so much, Mary. So a lot of the skills that I learned as an IT manager, I was absolutely able to use as a nurse. IT definitely requires analytical skills, which are directly applicable in nursing as well. In IT, you have to gather all sorts of data and inputs to think logically about how to solve a problem. You're doing the same thing in nursing. You are looking at your patient's signs, symptoms, and labs, and you need to synthesize that information so you can prioritize interventions. The communication skills I learned as an IT manager were also helpful in nursing. It helped me to communicate effectively with doctors, nurses, and other interdisciplinary team members. It helped me to synthesize information and present it in a logical way. And it made me more comfortable in asking questions and seeking clarification on things. On the other hand, things that were totally new to me were the hands-on skills. So drawing medication up in a vial, inserting an IV, or changing a patient's diaper without getting poop and C. diff all over their clean sheets. Those were all new things to me that my previous career did not help with. But you can learn those things easily over time with practice and repetition, so it's not a big deal. Another key difference between these two types of careers is that nursing is much more fast-paced and much more physical. I can clearly remember long, drawn-out meetings when I was an IT manager where I would sit in a conference room and just eat bagels or donuts just to stay awake. Aside from the occasional meeting, my day-to-day role as a nurse was very fast-paced. When you are providing an update about a patient, you have to get right to the point and make it very succinct. Nursing is also very physical, to a fault in many cases. So as a floor nurse, you're going to be putting in the steps, you're going to be helping to lift and move patients, etc. So in one way, it's nice to be more physically active, but it's also really easy to get hurt. So you really need to be careful.